Hello. After a while I'm doing these YouTube videos, I'm kind of intrigued with various things. Certain things that we know are good, but in the modern day medicines, we need to have a proof for it. I mean, good diet, not eating too much fat, not smoking, not indulging in excessive alcohol use, or for that matter, even use of drugs, etc. All these things we know that are good. However, the proof is needed. And nowadays, with the availability of various studies, we can comfortably and confidently say that certain things works. We all know that doing exercise is good. We also know that sleep is essential for good health. In past, I've talked about slow wave sleep and adequate sleep and the dementia. Apparently, the slow wave sleep seems to clear certain abnormal proteins, and that seems to help prevent dementia. But this time, I'm talking about doing an exercise and having an adequate sleep. So the question is that if you exercise, then you're going to have better life, less mortality, and less morbidity. But at the same time, if you're having a short sleep, how would that affect? So just to kind of analyze this, there was a study which was published in one of the cardiology journals, and I kind of got intrigued with it. It was an interesting study because they actually measured the amount of exercise that somebody did. And as usual, they classified it into a mild, moderate, severe, but at the same time, they also had a vigorous exercise as one of the things to change into it. So moderate vigorous was also done. And then there was also a mild, intermediate, etc. So the question that they wanted to answer was the combination of two factors having an effect on three different things: overall mortality, cardiovascular mortality, and mortality related to cancer. So the study was done among 92,221 patients. So it was a fairly large study. And the average follow-up was 7 years, which again is good. The age was also good because it was 40 to 73. So even the younger population and to some extent older population was involved. Because many times we say that if you haven't done it for entire life, what is it when you are 65, you start suddenly doing things? Is it going to be effective? So the age group was 40 to 73, 62 plus minus 7.7 or 8 years. 56% were women because again, we think that the effect of these kind of modification is not as good in women as it is in men. And they had defined sleep as short, normal, and long sleep, exercise as low, high, intermediate, and vigorous. So as I mentioned, there were 7 years of follow-up, and out of these 92,221 patients, 3,080 died. 1,070 died because of cardiovascular mortality, and about 1,871 died because of diagnosis of cancer. So they analyzed it statistically as to the effect of vigorous exercise and whether that helps or not. The answer certainly is obvious. The exercise definitely improved the longevity, reduced the cardiovascular mortality, but it also reduced the overall mortality and also reduced the mortality which could have been associated with short sleep. Just to kind of give you some understanding, the short sleep and a long sleep, both are detrimental to health. So people who sleep short, 4 hours, are sleep deprived, and that causes problems with overall mortality as well as cardiovascular mortality. The long sleeper, like those who sleep 12 hours, this is also detrimental to the health, and these people also have an increased mortality. Again, the reason is not very clear. I have my own explanation for that. But remember, the normal sleep is required for a good, healthy lifestyle, but short and a long, both sleeps are detrimental. A lot of people will find it difficult to understand why long sleep is detrimental. But anyway, so the way in which these curves are drafted or drawn, it is interesting that the cardiovascular mortality and the sleep is a U-shaped curve, which means U-shaped curve, which means people who have a short sleep have a high mortality. Then as you go down the curve and approach the normal sleep, you have a low mortality. Again, when you start increasing the sleep, it goes up. So the curve is U-shape. So the U-shape cardiovascular mortality and sleep is an interesting one to me. The second one is that the occurrence of cancer, and it was interesting, it was not associated with either the short or the long sleep. So the good part, or the good thing that came out of it, is that even though cardiovascular mortality is associated with short sleep and a long sleep, and a normal sleep prevented it, the cancer occurrence is not dependent on amount of sleep. Again, we can understand that there are many factors which affect getting the cancer and the cancer mortality, like smoking and a bunch of other factors, including chemical exposures and all that stuff. So cardiovascular mortality is U-shaped, while the cancer mortality is not. The all-cause mortality, not necessarily dying because of cancer or cardiovascular, is actually L-shaped, which means the L. So the people that sleep less have high mortality. As they start sleeping normal or towards normal, mortality drops. And even the long sleepers don't have an increased mortality like in U-shape. This is a all-cause mortality. So the difference is between cardiovascular mortality, long and short sleepers have a increased risk. All-cause mortality, only short sleepers have an increased risk. And the cancer occurrence and death is not related to sleep duration. The second interesting point that came out of this particular study was that when people did vigorous exercise or moderately high exercise, it is supposed to help to reduce the cardiovascular mortality, which it did, but it also compensated for inadequate sleep mortality. So people who did not sleep well or did not sleep enough but did the exercise, it helped. So 2 out of 1 is not bad. Again, sleeping normal hours of sleep is tremendously helpful for everything, including probably prevention of dementia. It also prevents occurrence of cardiovascular mortality. However, if you are compensating by doing a vigorous exercise, and they actually measured how much you were doing, it certainly helped to reduce the cardiovascular mortality. So essentially, the conclusion of the study is that vigorous exercise does help to reduce the cardiovascular mortality, all-cause mortality. The low sleeper and high sleepers have an increased risk of cardiovascular mortality. The cancer risk was not affected by sleep. Doing exercise did prevent effect of lack of sleep, and all-cause mortality is increasing people who sleep less, but is not increasing long sleeper. Little complex study. I hope you like it. Sleep well, exercise. Thank you for watching. If you like, please subscribe. Have a nice day.